Before taking part in any form of exercise/fitness assessment, there are three main points that have to be addressed. Health screening, which also covers PARQ test, heart rate, blood pressure, and lung function. Also a written consent and a risk assessment. All these tests are very important because they help to diagnose the participant for any health conditions, i.e. heart problems, high or low blood pressure, and lung functions. Harris and Anderson, 2009. By using the test, it will help the instructor to develop a better understanding for the client and the client's needs. And Lawrence, 2012.
The PARQ is a self-screening assessment about an individual who is planning to start an exercise routine or program. It determines the safety and the possible risks an individual has previously occurred in their health history. It has been seen by Giovannino, 2010, that some adults may have some problems with physical difficulties for particular exercises. This is a major reason why leisure centres and gyms ask all members to complete a PARQ. However, organisations that do use the PARQ need to keep clients' personal, private information in a safe and secure place, as the Data Protection Act 1998 states it gives greater sense of security about an individual's personal details. Screening is a process of precaution before taking part in fitness testing and structured exercise. The reason why personal sport trainers use screening is because it keeps them covered. It also identifies any risk factors such as primary, secondary or injuries. Individuals are screened by questionnaires and physiological measurements. Olds 1999 states that pre-exercise screening is very important in finding out the potential risk for all participants enduring in an exercise program.
A risk assessment is to put in place to limit the possible risks that may occur during the fitness test. NOAA 2009 states that in a risk assessment phase, you identify and analyse the risks or loss exposures that are involved in your sport or recreation program. Knowing the potential risks and analysing them will limit the possibility, as you would take precautions to either eliminate or reduce the possible risks. Health and Safety Executive 2011 suggests that it is hazards in the workplace that may cause harm. For example, this could be working with chemicals, electricity, etc. In our case, a hazard potentially could be that a client is not wearing appropriate footwear for the test. This is a hazard and brings in the risk of a client causing an injury. Legislations are acts that have been put in place by the government for society to abide by. Such acts have been put in place to protect society and to also protect organisations against any lawsuits or problems that may occur. Some acts are used in fitness testing, such as the Health and Safety at Work, etc. Act 1974, that was said by the National Archives 2002. This is to ensure that society is safe in the workplace. When carrying out fitness testing, the health and safety of the client is essential and must be taken into consideration when performing the test. Other legislation acts, such as the Data Protection Act 1998, said by the National Archives 2002, will also be included in fitness testing.